The ability to sit with a patient and realize that there's a story being told. That your physical health is a story, and that it's no different than the story of your childhood, or the story of your work, or creation that you're doing in your art studio. Your health is also a story. It unfolds. And as a psychotherapist, I was able to sit with my patients and when I was a psychotherapist, before I became a physician, and teach them how to understand the limitations of their minds or their hearts or their fears. That sometimes in the Western culture, we think that our fears are true. And I remember a bump sticker that really spoke to me many years ago that said, "Don't believe everything that you think." And so my goal as a psychotherapist, it was to sit with my patients and say, do you really believe this is true? Or is it your mind telling a story, creating a script? So translating that into medicine is the same thing. If somebody comes in and say, I want to be in the most optimum health that I can be, my first question to them is, do you believe you can? Because if they say, no, I don't believe I can, I have to put whatever medical goals I will have set aside for that person and work with their minds. And say, well, let's look at that. What is it in your history that tells you that you cannot? And so we start to break apart the history, which sometimes is experiences growing up, maybe a failed attempt to accomplish something physically. Whatever it is, there's a history that is now influencing the person's present moment.